All right, folks. Today joining me is Dr. Lekie Dwanyen. She's a tenure track assistant professor in the Couple and Family Therapy program in the Human Development and Family Studies Department at Michigan State University. Go Sparty! As a systemic family therapist and global mental health scholar who studies trauma in the context of families, Dr. Dwanyen uses narrative approaches in her practice. She specifically draws on narrative exposure therapy to reduce complex trauma symptoms among clients living with post-traumatic stress disorder, and narrative family therapy to address relational challenges in couples and families. A lot of this work has been adapted and is being used across the world. While she also appreciates approaches like emotionally focused couples therapy and other trauma-friendly models, Dr. Dwanyen is motivated by her belief that all families deserve access to quality, affordable, and culturally affirming mental health care at the global level. I mean, this is something we need all around the world, right? So, Lekie, I'm so glad that you're here. You're also a graduate of the University of Minnesota. I have to put that plug in there. And a master's degree graduate from University of Kentucky's Marriage and Family Therapy program. So, just real briefly, how did you find MFT? Like, was that something you had your eyes on as a young child? I mean, how did you get to it?
No, it's not something I thought about early in life. I studied family social science at the University of Minnesota as an undergrad. And still, as an undergrad, I didn't have any idea I was going to be a therapist. However, later into my career, I did some research actually in South Africa that then led me to I guess, clinical scholars, I'll say, and I became interested in both therapy and research. I applied for the couple and family therapy master's at Kentucky because I realized my next step really was to find a way to work on the ground with families. I specifically wanted to work with kids that were impacted by adverse family experiences, chronic stress, overburdened parenting stress, et cetera. I wanted to help support children in the context of families. And then that led me to MFT or CFT, as we call it. So that is sort of along the lines of my journey. I knew that I wanted to stick with marriage and family therapy or couple and family therapy through my master's program and after because of how staked it is in a systems framework. I was practicing with my master's. I thought maybe, you always had to have the entire family in the room to be a family therapist. And while that is welcome, it's not necessarily always the case. I appreciate that our field is really committed to thinking about people in the context of their relationships and in the context of their community and their culture and their histories, regardless of if it's one person, if it's children or adults, or if it's a couple, or if it's family. So it's really the systems model that kept me going.
Yeah, great. Thank you. The model that you identify with or practice from, I should say, how do you refer to that? Is it narrative therapy? You've also talked about narrative exposure therapy, which is a particular approach for people who have survived trauma and are dealing with trauma. But can you talk a little bit about the difference between those two things, or which model kind of informs your work?
Yeah, so I refer to myself as a narrative therapist. If I have to pick an approach, it's narrative. Uh, I should say, back up and say, I study trauma in the context of families, like you said early on. And we're still working toward developing a well established trauma intervention at the family level. So, interventions that are reducing PTSD symptoms, which is what a lot of clients that I work with present with. Those interventions are individually focused for the most part. And so I use narrative exposure therapy, which is an intervention, one of the first models that addresses complex PTSD. But that model has to be complemented with a family model if I'm working with multiple people. And so I rely on narrative family therapy, principles and practices in my relational work. So because I'm trauma focused in my work, I do really see the value of using a trauma focused model that reduces PTSD symptoms, which is where NET comes in, and then narrative family comes in to address relational problems.
Yeah, great. Could you give an example of maybe one of the interventions that is common with a narrative approach, how you've used it, how it landed on a family, specifically kind of focusing on an intervention that focuses on a relationship or a relational aspect of a client, and of course, guarding confidentiality and things like that.
Yeah, certainly. So with a narrative approach, one thing that we do specifically in narrative exposure therapy before the exposure treatment is a lifeline. And I'm speaking on this one intervention because the lifeline is usually well received and an exciting intervention, regardless of if we're focusing on trauma or not. So narrative approaches, this is something you can bring in if you're just working with a narrative approach. Essentially, what I do is ask clients about their significant life events from the time of birth or what they remember from birth through early childhood, all the way to the present day. So we're mapping significantly positive events or those events that folks rate as welcoming, as encouraging, as positive, whatever that means to them. And then along the lifeline, we also map those distressing events or traumatic events, especially if we're doing narrative exposure therapy. The idea here is that we're giving clients and ourselves a roadmap of their significant life experiences, and we can either use that to continue treatment and focus on, maybe doing exposure on the traumatic events, or maybe we're looking at significant moments of anxiety, maybe we're just looking at the client's life in general. And to be honest, this has been really well received by folks because they just want to see their life come together in a way that they normally don't think about it, right? And I think it's really exciting as a therapist to be able to map out our life. The lifeline is not what reduces PTSD symptoms when it comes to narrative exposure therapy. It sets a roadmap. In narrative family therapy, we could talk about, or we can map on significant moments in relationships, significant moments in the home. Maybe it's different relocations. Maybe it's different moments when folks were launched out of the home, or when children or family members were brought into the family system. It can be really a great assessment tool and a great intervention tool.
Yeah. Do you have any recollections of after you've done that with a family or a couple or an individual, in a clinical setting, how it's been received, or what clients have said about this particular intervention as they see kind of their whole life laid out? And you talked about specifically like they target those moments that were welcoming, those moments that were affirming, those kinds of things.
Mhm. Yeah, clients really enjoy seeing both positive and negative events. And we want to be, I put quotations earlier because we want to be careful as therapists not to not to insert our own assumptions of what positive or negative
Yeah.
means. And so when we do follow the client's lead, which is, kind of the premise of a narrative approach, we work with clients as though they're the experts of their own lives, right? So when they're walking us slowly through events and we're giving them the time and space to really, one, deconstruct their lives so that they can reconstruct a more full narrative, and they see these events coming together, one, they're able to somewhat name new things that they maybe didn't before. So I have clients that didn't necessarily want to start a complex trauma therapy, but we did the lifeline event. I mean, we did the lifeline intervention. And it was through the lifeline that a client I recently had just sat with it and realized I have been through a lot.
Yeah.
And that 17-year-old girl that I, continuously feel like reacts in the present day, I see why she had to survive. I see why I am such a survivor now, or I react to things so quickly. Um,
Mhm.
because I've tried to really, clients really do try to disentangle what they've gone through, but it sometimes takes an intervention that and support to map on significant events to know, like, yeah, I'm affected by traumatic stress, or yeah, this level of anxiety that I feel today is built on, my having to be forced to react to certain dangers. So it can be very affirming, whether trauma or not.
Yeah, so the image that you paint of, me seeing my life out in front of me, like I imagine that, and according to that narrative model, right? Maybe there's one or two events or one or two times in your life, they become defining moments. They become the main script, right? And so I love how narrative is always about what's on the margins, what stories have been really pushed to the margins, smaller text that we don't ever pay attention to. And so when you guide somebody through this, you're presenting them with this gift. Like, this is the entirety of your life, not
Right.
just this one time in your life where you experienced abuse, or not just this one time where you had this one experience, but it's all encompassing. Michael White talks about, our clients' lives are situated in stories, and you're helping them tell a story, tell their life story, right?
Mhm. Yeah, absolutely.
Yeah, incredibly powerful.
Yeah. And, I like to, with narrative exposure therapy, the goal is to develop an autobiography that they can take with them. But if I'm doing a lifeline with a client at all, no matter the intervention specifically, I like them to be able to, yeah, walk away with their lifeline because it's their story. And it does help them thicken how they think about who they are, and, yeah, thicken that description, which is a goal.
So as you how did you get to narrative? Like, what was it about the other theories? Like, I talk sometimes about foundational family therapy theories, the structural, the strategic, and I kind of put narrative more in the contemporary kind of theories. What was gravitational? Like, what pulled you to narrative and kind of moved you away from embracing some of the other tenets of those other foundational theories?
Yeah, so I mean, I believe in multi-generational family systems therapy, and so I'm always starting with the or prioritizing the family generationally. So I would say with that orientation, I can map on a narrative approach, and I choose a narrative approach because it is one of our main models that talks about culture and society and brings in uh, like social relationships, context, and social justice, like right into the model. It's strengths based. I actually believe a lot of our therapies can be strengths based. It just depends on the um, behaviors and the approach of the therapist most times. But narrative therapy integrates this strengths based client as the expert um, foundation, which I really appreciate. And it also complements narrative exposure therapy so well, which is my trauma focused model. And I think the two work together pretty seamlessly. I do appreciate emotionally focused therapy, family, in the context of families, because I find that a lot of trauma sensitivity, or the ways that family therapy can be trauma sensitive, are found in an emotionally focused therapy approach. But all things together, narrative does fit my philosophy and my practice in multiple ways.
Yeah, that's one of the message. I'm so glad you said that. It's one of the messages I keep trying to get to students is that there are all these models, and you're going to gravitate towards some because of things about you, like the way you are and the way you see the world. And some of those models are just not going to fit. Doesn't mean they're bad models. It's about a resonance with who you are as a human being, I think. Do you have any words of wisdom or words of advice for people who might be interested in this model?
Words of wisdom. You know, if I think I would have different words of wisdom if it's a trauma focused route or if it's narrative family therapy in general. Trauma focused route really involves a lot of acceptance and readiness to encounter deeply traumatic events with clients. And so it's not a model that's meant for every therapist. And so I would just sit back and encourage people to, read on it, talk to folks that have done it, really assess our own comfort level in hearing and sticking with folks in their deepest traumatic memories. In terms of narrative family therapy, I would say read read on the history of narrative family therapy. Like you said, Michael White is one of the pioneers, and I think narrative therapy actually maps on to, I said it was a philosophy thing for me. So when I think of narrative family therapy, I think it fits well with some psychology, like Black psychology principles, right? And the ways that narrative makes room for like culture and context, politics, if we allow it to come into the room, right? It's on us if we allow it into the room. I think that it really reminds me of the principles of mental health and psychology from sociocultural diversities, if that makes sense. So, yes, I guess my encouragement is just to read more into it and see whether it fits with your philosophy and practice or not.
One of the words I use when I talk about narrative therapy, and I don't necessarily identify as a narrative therapist, but there are elements of the model that I use: externalization, looking for exceptions, those kinds of things. Um, but I remember reading about it and in grad school and feeling liberated by it. That I didn't have to show up in judgment of someone's life. That it could just be another way of doing life. Like the idea of there are no, capital T truths, for example. It was, so I really experienced a liberation that I didn't have to show up in judgment. I could just let the stories be the stories.
Mhm. Yeah, absolutely. And, I have found that sometimes, maybe in observing therapy when we're not working from a model, sometimes we can let clients just unravel and speak and, frame that as us letting the story unfold, right? But there are procedures, there are, ways to implement narrative therapy, like you said, with these different interventions. So there is a guide, and it's not just necessarily coming to listen to people, word vomit. There's really important questions that should be asked about how they see the world and, their family's background, their family's history, community history, all of that.
Yeah. Lakey, thank you so much for being with me today. Is there anything else you want to say about this?
No, I can't think of anything. This is
I'm sure you could probably talk it for hours and hours on this, but you're one of my favorite people in our field, and I'm so happy that you do what you do. I'm so glad you're at a place that values your work and the contributions you're making. So it's just so much fun to follow your career. Thanks for being with us today.
Thanks, Steve. You're the best.
All right.